Okay, my name is Michele Tourné. I'm a physical therapist and pediatric clinical specialist. I'm currently an adjunct professor here at A.T. Still University.
Now, Dr. Deanne has discovered in the survey, along with her colleagues, that physical therapists are not using standardized tests to assess motor function in children, their physical abilities, in the way that they were intended to be used, or not fully. Can you tell me what are your thoughts about that finding and what you think could be done about it?
Well, I think this is a very interesting study because I believe that a lot of people modify the test to make the child successful. And you have to realize that it's been standardized for children that have typical motor skills and typical cognitive development. And many of the children that come to physical therapy don't have the ability to follow directions, or they have attention deficit disorders. And so as therapists, we modify it. I think the difficulty with that is if I were to see a child and modify the test and then score them according to their peers, and then I go on vacation and somebody else takes over my caseload, they might not realize that I modified the test. They might get different results, and then they wouldn't be able to tell if the child has changed, if they've gotten worse or better, because I didn't follow the same directions that the test asked me to.
Of course, what Deanne has done is she's quantified that amount of
Yes.
management of the issue, hasn't she?
And it's surprising how many people do modify the test.
So what do you think needs to be done about this?
I think that it's hard because sometimes you can't get a child to cooperate and it's frustrating. So if you have to use a standardized test, I think maybe looking at the child's abilities, maybe if you have to modify it a lot, not using the age comparisons, just looking at the skills, and then really being detailed about how you got the child to comply with the test item might be helpful.
So what's a kind of take-home message in your opinion about what physical therapists need to think about?
You should, as much as possible, try and follow the standardization if you want it to be accurate and if you want to compare the child to their peers.
My name is Andy Albrecht. I am a physical therapist and owner of Spotlight Pediatric Therapy, and I'm a physical therapist and pediatric clinical specialist.
We've been hearing about this new research, very interesting and perhaps to some extent disturbing research, that physical therapists need to modify standardized tests. What do you make of this, and what's your opinion about what needs to be done about it?
Well, I think with all the standardized tests, it's so specific on how it's supposed to be administered, and it was designed that way to get all these norm references for us to compare the kids that we're evaluating against. But the thing with pediatric physical therapy, or myself as a clinician, is I'm looking at each kid individually, and I'm so used to making modifications for these kiddos to make them succeed or get the truest sense of what their abilities are. So I think it's just kind of in our nature to be modifying what we do to be able to assess what the child can actually do.
Does that mean that you're being unscientific and that's okay?
I don't think we're being unscientific, because our assessment, like our observation of the child, is what we're trained to do. And so when we become so ingrained in having to do a specific standardized test the exact same way, we may not be getting the true sense of the child's ability. But in order to rank that child according to all these other the norm data that we have to do it the standardized way. So it's kind of playing between, should we be looking at the child's true ability with this skill, or should we be applying it the way that it's supposed to do to compare it against a typically developing kid from the way that they administered or standardized the test?
So what's your recommendation about what physical therapists need to be doing, given this real-world situation of needing to assess a child and then needing to choose the optimum therapy for that child?
Well, I think ideally, in the perfect world, if we can be administering the test in the standard way to get our norm data to qualify kids for services or create a baseline, that's the best thing to do. But I think we still, as physical therapists, need to rely on our observation skills, because that's going to give us the truest sense of the child's ability. So looking at their compensations, looking at how they move, is going to give us the best clinical reasoning to be able to develop our plan of care or qualify the child for services.
Now, you've done the investigation. It's not your place necessarily to implement this, but what thoughts do you have about implementing these research findings that modifications are being done to standard scorings, which could partially invalidate those scorings?
I think that we definitely need more awareness. A lot of the therapists that I talked to afterwards and gathered information from, really weren't aware that what they were doing was a problem. So as an educator, I think it's absolutely essential that we inform the therapists going through school now, as well as those already out practicing, about the importance of sticking with the standardization when you're using the normative scores, and then doing a secondary scoring if those modifications are used.
So what are your recommendations to physical therapists in America, where most of this research was done, but also around the planet?
My recommendation is that for now, with the tests that we have, when you're administering it, that you need to stick with the standardization, score it that way, and then if you feel like it's really not getting at the child's motor ability or they're not understanding the directions, go ahead and do that alteration, but that needs to be a secondary score that's not added into what is actually reported as the standardized test score, but just an additional part of your evaluation.
Now, every child is different, so how close does this new understanding help you to reach the important endpoint of giving individualized therapy to each child, do you think?
As a profession, we're really growing in that our evaluations are a combination of many different things. We often need to do standardized assessments to have them qualify for services, but that certainly isn't the only thing that drives our intervention. So when we're planning the intervention and selecting our goals, how they performed on a standardized test is simply one item, and your assessment really should be more comprehensive, getting at not only the capacity of the child to perform that test, but really what is their performance like on a daily basis.
So what's the brief take-home message for physical therapists and indeed for parents of children with disability?
That when we're administering standardized tests, in order to compare the scores to the normed scores that were previously collected, you have to follow the standardization of the instructions as in the manual. But that's only one piece of the information, and so I'm not saying it's the only way we assess the child. You can do those modifications and do those alterations, just make sure that how you report the scores is separated in your evaluation.